We're going to talk about Outbreak in RCFE, assisted living. You guys have a different guidance than skilled nursing. Um, but basically, if you have an infection, um, it can reach an outbreak phase, right? And we'll go on, I'll talk about what is an outbreak. Outbreak is a sudden increase in number of disease cases in a specific location or population over a period of time that exceeds what is normally expected. So, for example, because we're primarily talking about respiratory infection, let's just talk about COVID because you guys have one case right now, right? If you reach 3 or more cases, you're considered to be an outbreak unit. Okay, so right now, I mean, really, all you're doing is monitoring to see if you have any more cases, right, of COVID. If you're in outbreak phase, you have to keep testing for 14 days. Whoever was exposed, you're going to test them the first week. If they're negative, then you're going to test them again the next week to make sure that they are negative for the next 14 days. There's also, you're supposed to monitor all your residents for symptoms and then kind of check to see when people are coming in that they're not, symptomatic. Your staff are not picking it up. So there's a lot more into it. And then you have to inform basically the county, right? Let them know that, hey, you know what, I have an outbreak here. Not only that, you're informing family members that you have an outbreak. So that way they're aware that their loved ones are safe, they're reassured. So there's quite a bit of stuff that goes on that you guys may not know, but there's a lot of handful of stuff that we do when you are an outbreak in comparison to maybe if you only have one. And that could be an outbreak. It could happen not only for COVID, but it could happen for influenza, RSV. Outside of respiratory infection, you can have an outbreak of diarrhea, right? Norovirus, right? You can have a C. diff, right? Outbreak. So you can have an outbreak on multiple things, on a lot of things. If you don't practice good hand hygiene and good infection control process, you can have everybody infected, including all your staff. And if you're infected, you're going to take that home and infect your loved ones and your kids, your parents or whatever. So make sure that if you, not only when you reach outbreak, but if you have a significant infection like COVID, C. diff, MRSA, ESBL, whatever it may be, right? You're taking precautions, right? You want to be safe. And to tell the truth, guys, outside of COVID, even if it's COVID, the number one way to stop the spread of infection is to wash your hands. Keep washing your hands, do hand hygiene, right? When you come out of residence room, just make sure you're washing your hands, okay? Take the initiative. Because I think a lot of people get the misconception, oh man, we got an infection going on. What am I gonna do? I'm scared. Instead of being scared, just be informed. Learn about the infection. Because there's infection that happens all the time in hospitals, in different places, and they know how to manage it. But you guys can do the same thing. You can come to work and be comfortable working with these kind of things because this is not something that you're going to run away from. If you plan to work in healthcare, you're going to need to know, like, there's infection that happens every day. Right? And it's up to you whether you want to take the initiative and learn to protect yourself and your loved ones at home. Okay? All right. So I went over an example of infection and cause outbreak, right? C. diff, diarrhea, which causes diarrhea. You monitor those people, but we're not going to talk about C. diff today. We're going to talk about respiratory, and that primarily means it could be COVID for most of the time. You can have an outbreak in influenza. Right? The winter time is coming. We're going to have all kinds of respiratory infection. Okay, RSV, right? That's different than COVID. That's different from influenza, but it's going to have the same symptoms. And you can have everybody sick in here if you're not familiar with infection control, right? So how do we know if we have an outbreak of respiratory infections? As I said, if you have 3 or more cases in your facility, you have an outbreak. And that means that if you have 3 people in your building that has one, let's say you have 3 versus 1, right? If you have 3, that means you have more viral load in your building because these residents are breathing in and out, right? And these viral loads are going up in the air. It's into the vent. So the more of these residents you have, the more likelihood you can infect more people. Okay? So that's why we take outbreak really, really seriously because we know it's going to spread, right? So you need to take precautions as a employee to protect yourself and your loved ones and the other residents who are not infected. Okay? But also, usually, typically, an infection, you wanna wait until 14 days later when there's no infection from the first day, right? Let's just say you got an infection that happened today. Within 14 days, if there's no more new infections, you're coming out of that outbreak. But if you test positive, if one of your residents tests positive on day one, and then 5 days later there's another one, you're gonna start that new day, right? So you're gonna have to count another 14 days from the second test. You have to complete a 14-day process basically to come out an outbreak. So I'm giving you guys information that you might not even really use, but it's good to like have that in your brain when you're working. Like when your manager says, "Hey, we're in outbreak," you already know that you're gonna be in that period for 14 days, all right? And some people don't get sick right after exposure, right? Especially with influenza and COVID, it takes 5 days, maybe sometimes 2 days, where you get exposed from a sick patient, and then it might take 2 or 5 days for you to get sick, or maybe it might even take 10 days. It really depends, right? So that's why we take that 14-day precaution to make sure that, hey, you know what, in 14 days, no new cases, we're out of this, right? Um, is there anything we can do different when we have an outbreak of respiratory infections? Is there anything we can do different when we have an outbreak of respiratory infections? One is with more infected patients and staff given in an area of viral load. That's what I was talking about. We have more infections, infected resident. There's more viral load in the building, so it's easier to get infected. Okay, but what you can do as a staff is ventilate more. Open some doors, open some windows. If you have a resident that's in a room that's infected, try to open some windows as much as you can. To kind of let some of that air out. Turn the fan on and blow it out. So just to kind of circulate some of that, viral load out the window. Um, these are things that you're probably not going to do, but obviously changing the filters in your AC in the whole building is going to help you as well. As I said, washing your hands in high touch areas, right? You can be picking this up in the door handles, in the phone, in the bed rails, right? This is why it's so important. When you go into a resident's room and like, oh, I didn't touch the resident, but you touch the door handles. You touch this and you touch that. You pick up the phone, and then all it takes is that not washing your hands or hand hygiene, and you rub it in your eye, you get it in your mucosal membrane, right? You can get infected through that. Viral load through the eyes could happen, right? In your mouth, mucosal membrane, that could happen. That can get you infected. So that's why it's really important to kind of really wash your hands. Okay. For primarily though, anything that's respiratory, you breathe it in. You get sick through breathing, right? Anybody that's 6 feet and closer, if it's COVID and influenza, it's droplet 6 feet and closer. You're more likely to get sick. You're not gonna get sick 100% of the time when you're exposed to a resident who's sick, but you just increase your chances. Okay. Um, Increase cleaning high touch areas. You want to talk to your housekeepers to make sure, hey, you make sure you guys are cleaning the door handles, make sure you're cleaning the bed rails more frequently, anything that's touched more frequently, right? You want to talk to your housekeepers and say, can you guys focus on cleaning these more, right? Um, you can also increase your testing of residents that are not infected, right, to protect them, to make sure they do stay negative, right? Um, we have those ability to test residents with COVID tests, right? Increased communication between staff and managers regarding new onset of symptoms. If you have somebody who's showing symptoms and they're negative, right, you want to tell your managers, because even though they're negative and they're showing symptoms of respiratory infection, you want to keep an eye on that resident. Right? You don't necessarily want to isolate them because they're negative, but maybe keep them in a different table 6 feet away from other residents. So these are just things that because they could test positive like 2 days later. And you could be like, I don't know, this resident is negative, but they have symptoms, and I don't want to isolate them because I get in trouble for them. You could just keep them in the room and take them out for activities. That's not really isolating. But you could also take them to the dining room and keep them 6 feet apart to their own table. Keep them on their own table until their symptom goes away, right?
How long does it take for the whole virus to test positive?
So let's just say if you're exposed today, right? You're supposed to test 2 days and 5 days later.
Okay.
So it might take 2 days, it might take 5 days, but that viral load that's accumulating in your system might take that long in order for the test to basically pick it up, right? So you could be brewing in your system, right? This virus is getting you sick, but your immunity is fighting it off, and you could be testing negative. And then eventually, if your system it gets overwhelmed, there's too much viral load, you are gonna get sick. Maybe 5 days later, you'll test positive. Okay. So, and there's some people out there that will test within the second day, you know, and then there's people out there who would test within 7 days or 10 days, right? That's why in an outbreak phase, we test every week for residents that are still negative to make sure they are indeed negative. Okay. And that's the reason why you manage to vote this test, there's 14 days, right? Having knowledge of the actual pathogen to improve the use of PPE's correct manner. So if you have an outbreak, you want to know what kind of viruses it is, right? Because if you have C. diff, that's contact, right? You don't necessarily have to wear a mask or whatever. It's all like gowns. It's all touchy, right? So it's important to know what you're dealing with, so that way you know what kind of PPE you should be wearing, right? Where in respiratory, you do have to wear a mask or N95, right? Um, Number 5, how can I protect my infected residents? For these residents, all you're really trying to do, if you have a patient that's COVID positive or has a respiratory infection that's, they're able to spread it, you want to make sure that their breathing is normal, right? You want to monitor their vitals. You want to monitor their temperature, right? Because residents who has high temperature for a long period of time, they can have a seizure and die on you. Okay, so you want to manage that fever with cool compress, cool cloth, Tylenol or whatnot. Okay, if that doesn't go down, you can put them in a cool shower, right? Kind of manage, decrease the body temperature. Again, fever itself could cause seizure, and you can have a resident, die from it. Okay. Um, Also, residents that are symptomatic, right? They need to stay in their room, right? If they can't wear a mask, they need to be staying in their room to try to protect you and the other residents, right? Symptomatic residents may continue with daily activities so long as they are able to wear a mask for 10 days from date of test. And I'll talk about that more on how to isolate a resident who's infected. Your main goal to the other that you're dealing a lot with in a setting like this is a resident who has COVID. A lot of times they have decreased ambulation and decreased their ability to eat and drink is going to be compromised. So a lot of these residents, they go into heart failure, they get dehydrated. If you're not walking a lot, you're going to have a lot of edema. Okay, and so a lot of these residents are so lethargic they don't want to eat and they end up getting dehydrated. And you're sending them out literally just for dehydration. So you want to pay attention to that. You want to increase fluids and try to at least do activities outdoor. Get them to walk around outside. Just because you're isolated doesn't mean that you can, you just keep your resident indoor. You can take that resident outdoor, and you can wear N95 or whatever, and you can do activities with this resident, right? To keep them kind of moving. Isolation is not recommended if patient is no longer taking meds for symptoms within the 24-hour period. So like I said, I'll talk about it at the bottom here on how to isolate a resident. How can I protect my uninfected resident? For residents that are uninfected but you are in outbreak mode, you want to try to keep them kind of 6 feet apart if you can. If not, totally fine. I know they're all negative. Sometimes residents are asymptomatic, but they're positive. So being 6 feet apart during an outbreak is going to be. I know it's difficult here because all your residents have dementia, so they're all kind of like want to come together. So it's very difficult. That's why when you have an infection here, it's so much different than like my building or Mary's building, because kind of like not only everybody's kind of eating in the same place, but everybody's demented, has memory issue. So it's hard to tell them, oh, don't go there, don't go here. They go everywhere, right? Residents who are able to wear a mask safely, have them wear a mask. And again, we're in a setting where a lot of them can't wear a mask, so it's unfortunate. Monitor respiratory symptoms, right? Anybody who's coughing during an outbreak, yeah, you want to monitor, you want to report that, right? Anybody who's warm, right? Congestions, any of that, right? Sore throat, right? But fever is one of those telltale signs that somebody is infected because it's systemic, right? We talked about ventilate their room, right? Open some windows, um, and then wear PPE when taking care of sick patients. If you're taking care of somebody who's COVID positive, obviously you want to be wearing some N95. Okay, these are much tighter than the blue mask. Okay, and so you want to wear these N95s. The KN95 guys, don't wear the KN95 during an outbreak if you're taking care of a sick patient. The K95, this is right here is approved by and the NIOSH right here by the federal government, American government, and the KN95 is made in China, so they're not as tight and they're not as regulated. Okay, this is what you want to be wearing when you have an infected resident with respiratory infection, right? Okay. Again, I know you walked in kind of late, but when you're dealing with an outbreak that's respiratory, you do have to wear I would wear an N95, whether it's droplet or airborne. This is typically for airborne. Okay, but I would wear this even when you're taking care of somebody who has droplet, which is influenza. Okay. So, and this is by 3M. We have a lot of these in the building, and this red one is, also has fluid resistance, right?
There's different ones of those?
Yeah, there's a blue one, right, and it's not as fluid resistant as the red one. Okay, so there's numbers and stuff like that. This is the 1870 plus, and this is approved by the NIOSH. Okay, and this is the federal government right here that approves all these masks, these N95. Okay, if it doesn't say that NIOSH on there, don't wear them in outbreak because you are going to get sick. Okay. Wash your hands, and then, as we talked about, clean high touch areas frequently. How can I protect myself and family at home? Kind of the same thing, you know what I mean? But primarily, if you have an outbreak in your unit and you're taking care of a positive resident, make sure you're wearing the right gear and you're familiar on how to take it off. Okay, I have videos and stuff on how to put on PPE and how to remove them. A lot of times it doesn't really matter how you put them on, but when you're taking it off and it's dirty, that's when you want to really pay attention. Okay, because stuff is dirty, and if you're just moving that around, you get it in your eyeball or whatever, you are going to get sick. Okay, so make sure you guys are watching those videos. I think I shared it with Mary. It's in the I'll put it in the RCFE video also in the channel that I have. But that's going to help you guys when you have an outbreak on how to don and doff PPE the right way. Right. Also, guys, if you're taking care of a positive resident, I know it can't be done all the time, but the longer you stay in that room, the increased likelihood that you are going to get infected. Okay. So try to go in there, take care of your resident, get things done, get their vitals monitored, get your respirations, and then try to get out of there, right? And then if you can't get out of there in and out quickly, make sure your N95 is on correctly, okay? Don't wear a blue mask, like I said, okay? So let's talk about isolation and how it works in RCFE, okay? If you have a positive resident, as soon as they are asymptomatic, and so long as they can wear a mask, they can come out of the room. We can't keep them in the room for too long. I know it used to be 10 days, but let's just say resident 1 it got infected on day 1. If day 3 they're no longer symptomatic and you're not using medication and they can wear a mask, they can come out of the room. Okay. Same thing for workers. If you're sick and you test positive for COVID, and then within 4 days you're asymptomatic and you have to wear a mask for 10 days from the date of your first symptoms, or when you test positive, you can come back to work. That's the new guidance. Right? What's that? If you don't have symptoms, that's managed by medication.
So they don't have to stay out 5 days and then test and then. Okay.
There's no more 5-day rule. If you test positive, you're asymptomatic, and then you're coming back, you do have to wear a mask for 10 days. Okay, so long as you're asymptomatic.
Or a regular mask?
It could be a regular mask. Yeah. But I would take precautions, guys, in terms of, I know we can just say, hey, I am asymptomatic. I want to come back, and there's nobody really overlooking that. But if you come back and you feel ill, right, like you have fever, but you want to come back to work, and nobody's really monitoring that, you're putting your residents at risk, basically. We are a lot, yeah. So you just kind of want to be, hey, you know what, I am taking some Tylenol for fever or whatever, you know. You really don't want to come in and risk your residents' safety. Okay. Um, so for resident, I know it's difficult. It's a little different with resident because if they can't wear a mask, they really can't get out of the room, really. So even though they're asymptomatic, they can't wear a mask. They should probably just stay in the room anyway, have activities as much as they can. I know here is different.
Yeah, they
but
don't stay in the room.
Yeah. So they do have to wear a mask. They got to be able to wear a mask. And a lot of your residents here can't wear a mask. So what does that mean? That means that they probably need to stay in the room for 10 days.
But they can't.
Yeah.
They don't stay in the room.
And they can't. And that's the other thing that's difficult is that they kind of. So for residents in the morning, maybe have a different area where residents that are positive, they can hang out in one area, right? Wear an N95. Let's just say you have 6 residents here that are positive and you have 1 resident here that's positive, right? So if they come out of the room, I would make this my positive like dining area. So and then keep all of them as they come out, bring them over here for activities. Keep them busy here, right? And then all your non-positive there do the activities over there, right? And then as you're taking care of them, I would just wear N95 and then walk them back to the room. I mean, I think that's what we did before when we tried doing this plastic thing. There's too much work, but regulations has relaxed a lot now. There's not a lot of guidance for COVID. A lot of it is kind of similar to influenza, so it's a bit relaxed.
Do you think it's ever going to go back, or not back to how it was, but are they going to be treating it as influenza where we don't have to be testing?
They might. I mean, so long as we have the resources available, they would require that you kind of test. Right now, there's really no testing anyway. Like let's for outbreak, yeah, you do have to test as often as you can. Test within 14 days. They might. I mean, I don't know. So if we have better vaccination that's available, and we have decreased number of COVID, I mean, they might. You know what I mean? All right, guys. Any questions on how to kind of keep yourself safe during an outbreak? The good thing is that your resident who's positive is not here. Okay, if they are here, right, you take extra steps to protect yourself. Again, if you're going into a room, you got to wear an N95. Okay, and you don't know who's sick because these residents sometimes are asymptomatic. If you're taking care of them, you're not masking up, you're probably going to get sick, right? Depends on your immunity and it depends if you're vaccinated. Okay, even if you're vaccinated, you could still get sick.
So let's say you're coming back from having COVID. Do you have immunity?
You typically have immunity for that strain. Next year it could be a different strain. That's why, vaccination is specific to a strain, right?
How long is that immunity for? Like 2-3 months?
It's usually typically it depends if there's a new strain that's coming out. If there's let's just say they have 5 different strains, right? And then the company comes out with a vaccine that's focused on one strain, and then the strain that like becomes dominant, right? It's not part of the vaccine. That vaccine's not going to work. It's the same thing as influenza vaccine. So there's a different strain of virus that comes out, frequently.
Yeah.
And so if it becomes dominant, means that it's infecting everybody. So if it's not infecting everybody, it's not a dominant strain, right? But if they pick the right vaccine and it's the dominant vaccine, then everybody's going to be protected. But it's like, you never know, right? You have 6 strain that's going around. They're saying, okay, this is going to be more dominant. And if they miss, that's why sometimes they have like 2 different strain that's in the vaccine. It covers both strains. So, yeah, and the way it becomes dominant is that if one infects the other and then it starts infecting more people, that's the dominant strain, right? And then the other ones who like basically doesn't become dominant because it's already the the brother or the sister infected more people, so really, and then the next couple of months, it could be a different strain, and that vaccine is no longer effective. Okay. Any other questions, guys, on anything? Yeah. Okay. All right. Well, I'll put this on online. Somebody else wants to watch it or whatever. I gotta go to another meeting. So
Thank you.
thank you.
Are you gonna take-
Yeah. Here you go.
you wanna take these?